22.2 Specific Groups Exercise Prescription. So GPs might prescribe exercise as an alternative for other methods such as medication to treat conditions. This prescription would only be suggested if deemed fit for the client's needs. Exercise helps to improve the efficiency of your body systems and your general health, which is why it's important for all people to have access to physical activity, including specific groups who have contraindications. Exercise must be prescriptive to ensure the client doesn't follow instructions incorrectly, which would put themselves at risk. To be prescriptive is to assign a specific frequency, intensity, time, and type for exercise. The exercise must be specific to the performer's individual needs, goals, ability, and preferences. It's almost like prescribing medicine. Much like medication is tailored to the individual's needs in terms of dosage, how often they take it, etc., the exercise must also be closely instructed for it to have the intended benefits and for it to also be safe. Furthermore, when prescribing exercise to a client, you have to ensure they know how often to exercise, how long for, at what intensity or how hard, and what the session will consist of. So that would of course mean the client has a full understanding of the technique needed in their prescribed exercise too. There are many contraindications in sport, and specific groups will have contraindications that are perhaps more absolute than others. So contraindications are conditions that make a particular treatment or exercise potentially inadvisable or completely inexcusable. There are two types of contraindications. Absolute contraindications, which mean the performer is definitely not allowed to do that activity, with no exception, as it has such a high health risk. Relative contraindications, on the other hand, enable you to work around the setback. They restrict what you can do, but don't completely eliminate the exercise, as it can be monitored. Examples of absolute contraindications are recent heart attacks, heart-related diseases, and severe illnesses. Relative contraindications examples include pregnancy, high blood pressure, and asthma. So I'll look into some of the specific relative contraindications and how within specific groups you can work around that and still prescribe exercise to clients even if they have relative contraindications. So the first group is pregnancy, and some of the absolute contraindications in this are if the pregnant woman experiences abdominal pain, bleeding, unexplained back pain, excessive shortness of breath. There perhaps might be more absolute contraindications as well as those, but there are also relative contraindications which you can work around. Exercise contraindications, so exercise that you should avoid, include high intensity exercise. High intensity means there's a high demand for blood and oxygen at the working muscles, which leads to a redistribution of blood that was previously going to the baby, as the blood now flows to the working muscles to compensate for the high demand at the muscles. Furthermore, less blood is supplied to the baby, and that results in less oxygen and nutrients being supplied to the baby, which obviously affects the baby's development. Another exercise contraindication would be contact sports. So contact sports come with a very high risk of impact on the baby. So to participate in contact sports would not only be putting yourself at risk of injury, but also be putting your baby's life at risk. Exercise where you're holding your breath for a while is also high risk as well for people in pregnancy. There's an increase in blood pressure to supply oxygen due to the lack of it from holding your breath. Furthermore, like previously mentioned, this lack of oxygen for the baby will hinder the development of the baby, which could potentially lead to disease or illnesses for the baby. And finally, obviously, activities where falling is likely. The reason for this is much like the reasoning behind contact sports being a contraindication. If the client falls and there is an impact on their stomach, it will have a great effect on the baby, putting the baby's life at risk of impact injuries. So how can you work around pregnancy and get pregnant women staying active and improving their health through exercise? As a result of these contraindications, it's recommended that the intensity of the exercise is reduced to a low intensity, and that the client participates in contactless sports where there is a low risk of falling or impact on the stomach. Therefore, exercise such as kickboxing or sparring is an absolute contraindication, as the baby has little protection or any impact, and any impact could end the baby's life. Furthermore, exercise that is usually prescribed during pregnancy consists of yoga and Pilates. Pregnancy yoga helps to maintain muscle tone and flexibility and improve your posture. It's kinder to your joints than more vigorous types of exercise. However, you should also do some aerobic activities such as brisk walking a few times a week to give your heart a workout as well. Therefore, my prescription would be to combine the both. So yoga poses that I would prescribe to someone who is pregnant include the ankle to knee pose, which relieves back pain and opens the hips, in addition to helping make space for your belly and open your back. This pose will also help relieve tension in your glutes and the muscles under your glutes. Another one would be the seated side bend, which relieves lower back pain, the yoga squat, which relieves tension in the hips, the wide angle seated forward bend, which relieves back pain and belly weight, and the low lunge twist pose, which relieves low back pain and hip pain. I've chosen each of these poses specifically because they relieve pain that is known to occur in pregnant women, so lower back pain from the weight of your stomach, the increased weight of your stomach, and also in the hips from that increased weight as well. And I would have the client doing that yoga and those poses every day, as it's not strenuous and it will continue to help relieve that pain, especially if the pain, lower back pain, perhaps consists. Of course, that won't take too long either. There aren't particularly too many poses, so it's just something to go alongside the aerobic exercise that I'll prescribe as well. So it should take no longer than 15 minutes overall to do all of those poses. The aerobic exercise that I might prescribe would be a 30-minute walk at a low intensity, and that would be 5 times a week. I don't want them doing it every day because that could be too much and too overwhelming for the client, considering they're probably already fatigued from the pregnancy as it is. And I'd like this to be done preferably on flat ground, as I don't want it to be too intense again. So if there's a path or area where it's flat, that'd be preferable, or perhaps on a treadmill, could be done inside as well. If possible, I'd like to regulate their heart rate, perhaps by using a heart rate monitor, and ensure that they're not working at a pace where their heart rate is any higher than 70% of their maximum heart rate. I don't want them to do any high intensity exercise that could put them and their baby at risk. Obviously though, if they have any of the listed absolute contraindications during pregnancy, then you wouldn't allow them to participate in this exercise at all, as it would put them and their growing baby at risk. The second group I'll look into is older adults. So contraindications include unstable medical conditions, hypertension, joint conditions, heart rates over 100 beats per minute, and of course various other effects of aging. As you age, your body systems begin to work less efficiently. This means there's a decrease in the ability of the performer as a result of their age. This also means there's an increased likeliness of injury due to their weaker body systems. Furthermore, this leads to a series of contraindications regarding older individuals. Those contraindications that I've just listed are included in that. Exercise contraindications include high-intensity exercise and high-impact sports/activities. Obviously, that is dependent on the condition of the older adult. You might find a perfectly healthy older adult that doesn't need to be aware of those contraindications, as they have perfectly fit body systems to cope with the demands of high-intensity exercise. Some of the listed contraindications are relative, while some are absolute. All of the contraindications are dependent on the extremity of the condition. For example, if a client had an extreme case of osteoporosis which caused them discomfort with movements, it's unlikely that you'd prescribe them any exercise that could lead to unnecessary pain or discomfort. Older adults involve a lot more differing factors to work around than the previously mentioned pregnancy. For example, you might prescribe someone with high blood pressure light exercise such as jogging. However, you wouldn't prescribe that to someone who has a joint condition that hinders their ability to bear weight. You might prescribe the client something related to yoga, where it eases the tension at joints. Therefore, the following prescriptions are specific to individual conditions and not the whole group of older adults. The first condition is hypertension. As you age, you're more likely to become hypertensive, which is a high blood pressure, consistently high blood pressure. If this is the case, then you would not have the client participating in high-intensity exercise which would increase their blood pressure further. You also wouldn't have them doing isometric contractions. When your muscle isometrically contracts, the muscle thickens next to the surrounding blood vessels, pushing against it and restricting the flow of blood in the blood vessel. This therefore increases the blood pressure in that vessel. If you're hypertensive, then your blood pressure is already high, so a further increase in blood pressure from isometric contractions puts the client at risk. The exercise you might prescribe for an older adult who is hypertensive might be light aerobic exercise. This is because it will keep blood flowing steadily at a rate that isn't going to be stressful on the blood vessels and isn't going to put the individual at risk. This aerobic exercise might be jogging regularly, which is obviously a form of continuous training. Again, you might have them doing something like 30 minutes every working day, so that would be 5 times a week, and you'd have them doing perhaps no more than 70% of their maximum heart rate, and a minimum of 60%, as you don't want it to be too easy where no adaptations can occur. Preferably you'd have a heart rate monitor, maybe a watch to measure their heart rate and ensure they don't go over that or out of that range. This exercise should not only ensure they're exercising with minimal risk, but the exercise could also potentially reduce blood pressure over time as the client's body adapts to the exercise, meaning the risk of their hypertension is also reduced. The second condition is joint conditions such as osteoporosis, ones that haven't taken too much of an effect but still have an effect on their lives. So with age, your bones become more brittle and weak, as does the cartilage at joints. If this was the case in your client, you wouldn't have them participating in weight-bearing exercises, as this could be painful or damaging on the client's joints. Therefore, you might have them doing light swimming, as this would not only mean the client is working at a rate that doesn't risk injury, but it could also enhance their joints by stimulating the secretion of more synovial fluid at the joints. You might have them swimming front crawl, where the range of movement is lesser than that of breaststroke, and you might have them doing continuous training in the form of swimming. They might swim 4 times a week, not pushing them too hard to the point where they don't have any time to recover, and you might have them doing 2 lengths of front crawl and 2 lengths of backstroke and repeating that for 20 minutes. This would be at a light intensity and a comfortable and sustainable pace for the client, which they would judge themselves, and that would be in order to prevent joint ache after those repeated movements and to prevent extreme fatigue as well. For an older adult with type 2 diabetes, if this is the case in your client, you wouldn't have them doing strenuous activity that causes them to sweat a lot, as type 2 diabetes can already cause thirst and fatigue. If you do moderate exercise, for example walking, that makes your heart beat a little faster and makes you breathe a little harder, your muscles use more glucose. Over time, this can lower your blood sugar levels and increase the effectiveness of insulin. Type 2 diabetes is when you have hyperglycemia, which is high blood glucose levels. Keeping your blood sugar low through moderate exercise will work in your favour and reduce the risks of type 2 diabetes. Furthermore, similarly to the other prescriptions, you would have the client doing light moderate exercise that would aid the client. This might be jogging at 65 to 70% of their maximum heart rate 5 times a week, and that would last 30 minutes each session. This makes it a zone where it's pushing the client but not too hard, as it's tailored to their heart rate.